question. I know Dr. Shweta has to go for a meeting. I want to take another medical question with her before we let her go, and then we can continue with the rest of the discussion so that we don't just keep her waiting here for another. Dr. Das, given the discussion we've had here, and of course the bigger problem of this affecting us, we've already spoken about the fact that yes, it is here, and yes, we need to take enough precaution. What is the possibility of this becoming a bigger issue for us in terms of if this doesn't stop in India for the next, say, a month, 2 months, which we don't see, given the discussion, now we know that we don't see this end anytime soon. People are dying, this is spreading, and there seems to be no plan in place. There seems to be no plan in place for this to end anytime soon. We are looking at a situation where this might pour itself over to the rest of the world. What is the best possible scenario for us, and what should we do so that we can safeguard ourselves here in America? We're not looking only at the Bay Area, but we have a huge community here in North America which gets affected.
As I said, Meera, that we have to continue practicing hand hygiene, wearing masks, and get vaccinated. And we have to encourage people, as many people as we can, to get vaccinated. And as I said, like we don't have the data how effective this vaccine is, but it is not like the vaccine will be 0%, 100% ineffective. So what it will look like, it will be like flu vaccine. You may still get COVID infection, but the severity of infection will be of lesser magnitude versus someone who has not got the vaccine. So that way we can at least help the health system not to be overwhelmed, and that we will see fewer hospitalizations. There will be still COVID positive cases despite vaccinations, but at least we can reduce the hospitalization rate. And regarding the travel ban, I know the cases are already here, but I think the travel ban will help us because the purpose is to slow down the peak, slow down the pandemic here. And I think that will actually help us.
So two aspects. One, the travel ban does not apply to American citizens, and that really, I mean, the virus doesn't discriminate based on nationality. So that's really not going to help right there. So that's one. And secondly, the more important question: our children are not vaccinated yet. And I know today Moderna came up with results that they're okay to vaccinate in teenagers and very soon the children. But our schools will be opening up soon, I believe. With all the precautions we're planning, especially in California, we're planning for schools to open up. How is this possible with this threat looming over our heads?
Yeah, Meera, you are right that the travel ban is not for U.S. citizens, and as I'm saying, we are just kind of reducing the magnitude of the problem by the travel ban, but not completely eliminating the problem. That you are correct by saying that virus doesn't discriminate between U.S. and non-U.S. citizens. And regarding the reopening of the school, it will be a challenge. I know the trials, we have only opened the vaccine for 12 years or up. We still have kids under 12 years of age. But the vaccination studies have shown that if someone has got vaccinated, the chances of transmission are reduced by 80%. So there is hope. As you said, we are not out of the woods yet. We have a long way to go. We can only take small steps right now by doing the vaccinations and continuing to continue taking the precautions that we have done for the last few months. Yeah.
Thank you so much, Dr. Das. This kind of answers our preliminary questions here in terms of how to medically prevent this from spreading. So I guess the first things first, we need to vaccinate ourselves. Irrespective of how we feel about getting vaccinated, we need to vaccinate ourselves. And I know there are two panelists that have to leave right away, Shweta and of course Sanjeev. Sanjeev and Shweta, thank you so much for being with us on this panel. Thank you for giving us an update on what all you've been doing to help the community be safe from COVID. And thank you for your participation. I'll continue for a few more moments with Hartosh and Amrit before we wrap up, and so that we can get a sense of where we're leaving this panel with. Thank you so much, Shweta, again, for your time and for doing what you do. And hats off to your dedication and all the effort, all the healthcare workers that have been with us through this pandemic.
Thank you for having me on the show. Thank you very much.
So, Hartosh and Amrit, now we have kind of come to a roundabout kind of a discussion here, and the most important thing that we see over here is, okay, so in terms of the hierarchy here, you feel that there needs to be a lockdown. You feel that there needs to be a government effort to vaccinate everybody. Push comes to shove, we need to. There's no other way to stop this. And thirdly, of course, there needs to be some very serious protocol in place that even after vaccination happens, this doesn't fall through. So, given that that entire thing, what needs to happen within the government for this to happen? What is the solution to this, so that no more people die? What is the solution? I'll start with Hartosh, and then maybe Amrit. You can take.
Look, I think we've already laid down a number of things. One is, of course, just immediate short-term measures, which is simple coordination of governance, which is oxygen. It is about providing helplines, which deal with, Amrit mentioned just hospital beds, but it also includes where you can get oxygen, where you can get vaccines, what's the situation on that. Just today, there is not a government facility where sitting at home, you can find out, this is my situation with COVID, what do I do? Testing is taking 6 to 7 to 8 days. It is becoming meaningless. We are not testing. So these are short-term measures that we have to deal with. There is a lockdown that has to, and through the lockdown, you have to accelerate the vaccination program to the extent we can. But as Amrit mentioned, we are such a huge population with all the acceleration, we are not going to vaccinate within the next 6 to 8 months. So during that period, lockdown controls afterwards and all the short-term measures that we are talking about, yes, because and the rest of the world should care, apart from the fact it is spreading from here. This is providing a huge lab for new varieties and mutations to take place rapidly in a way that is not being monitored. We are so far not sequencing what is happening in India in the numbers we need to, even though we have the capability. We are not looking at how effective this data has not been done clinically, of how effective the vaccines have been in this round at preventing people from getting infected. This is data that should have been easily collected, compiled, and actually published by now. We have enough information from hospitals, but nobody is doing that because, again, direction is lacking from the top. All these are steps that have to be done for ourselves and the rest of the world. And you must realize what it means for India to keep ramping up the demand for vaccination. In this huge way, the rest of the world is going to get a shortfall of vaccination when it spreads from here. It will spread to other places where people have not been vaccinated because India has been hogging the vaccination. So it's a catch-22 which is going to affect everybody.
No, you're absolutely right over here, Tosh, in what you say. If India does not resolve its situation, it affects the rest of the world. It's not India's problem alone, it is the rest of the world. And if India has failed to contain it so far and so many people are dead, it's really not. The whole world has failed India. And that's what I would say, because the whole world wasn't there. We should have stepped up much earlier. We should have seen what's going on. We should have kept tabs on what was going on in India. We should have stepped in much earlier. You're absolutely right about that. Amrit, what do you think? What do you think the hierarchy of things to happen have to be to resolve the situation?
The first thing that has to happen is for the government to wake up, Mr. Goyal has been talking about efforts that he's making and the IIT alumni are making to help people. And yes, citizen groups, civil society everywhere is contributing in many ways and they're doing a great job. Nobody can be faulted there. But this government is focused entirely on media management. While we are going through a crisis, there have been meetings held on how to control the media narrative, that is, international media, how the media is reporting the situation in India. So they have their priorities all wrong. They are more concerned about what the international media is saying and how they're criticizing the government rather than focusing on How do we save lives? What measures do we take to save lives? So there needs to be a realignment in priorities away from how do we protect our image to how do we protect our citizens, which just the fact that I have to say this is so depressing, because, why do we even need to ask the government to say like, hey, you need to protect us?
I'm so sorry. I'm so sorry. I mean, I'm so sorry that it's come to this. No citizen of any country should be saying that to their government. It is the duty of the government to make sure they have the systems in place to protect their citizens.
Yeah, and this goes back to earlier policies of this government also, but I'm not talking about them right now because we're limiting this discussion to COVID-19 and the crisis that we are right now. But this is a thread that can be seen from demonetization and even earlier to, the Citizenship Amendment Act and various other policies that they've undertaken, where the priority is not the citizen, but something else.
So before we wrap up, I think these are the last thoughts we have. So I think the summary here is that there needs to be a national lockdown to contain the spread. There needs to be an improvement in supply chain somehow, even if that means that we have to beg, borrow, steal. India has to beg, borrow, steal from other countries. They need to let people help. Then, of course, vaccinate everybody as soon as possible. Everybody needs to be vaccinated as soon as possible. And I guess after that, look at where the system has failed, look at the points of failure and do some design thinking around how these failures can be addressed. Everything else is short term. Is this where we stand?
I think so, because right now the crisis is so immense and so unfathomable almost, that any measures that need to be taken should be short-term measures to make sure that at least we prevent deaths, and once we've dealt with that, we can think about longer-term measures.
Well, thank you so much, Hartosh and Amrit, for being a part of this discussion. This was really useful because now we know exactly what the scheme of things needs to be to stop at least millions of people dying the way they are. I believe today a little over 4 million, 400,000 people are dead as of today. Today's count, and it's the highest for any country to clock in the history of COVID.
That's the
in a single day.
I think that's
the number of cases.
That's the number of cases. So how many deaths happened today?
Just under 4,000, I believe.
And that's also. I mean, in terms of number of cases, as the highest, right, for any country to clock in a day, in a 24-hour period.
Yeah.
So having said that, we do have some other comments coming in from people. Of course. There is this entire twist that Modi government is coming in. Ashish Mantri says Modi government is already declaring third wave on its way. And do they not know that a wave has a crest and a trough, and second wave is never going to end? But they've started propaganda about a third wave. What is this third wave? So this is confusing for people. When did the second wave end for them to start a third wave? Is what listeners are saying, our viewers are saying. Then they're also talking about that the government of India had since December to set up supply chain. Ashish Mantri again. People can't do that yet time again. People blaming has been going on. Why do you think it's the citizens' responsibility alone? It cannot be the citizens' responsibility when they are at the receiving end of things, and there's hardly anything that they can do about the situation. And of course, Archana Sudham again said India has zero leadership, and even the media is spreading fake news and propaganda. The sole agenda is hate all other countries who are lending a helping hand. Well, this is what our listeners have to say about this. We've kind of answered most of these. We've looked at different perspectives of this problem, and we of course will come back and see where we are in a few weeks from now, if situation hasn't improved, and if it has, what really led to a change here. We will hope that there will be some drastic steps taken very soon to get things under control, and we see an improvement in the situation on ground. Till then, all we can say is keep the faith, and thank you so much for being brave and reporting the way you guys do. Thank you, Hartosh, and thank you, Amrit, for being the brave soldiers on ground and reporting things as they are. And this is Mira from Radio Zindagi, 1170 a.m. San Francisco, San Jose, saying bye for now. Take care and goodbye.
Thank you.
Thank you.
Thank you.